Okay, so let's talk about Pediatric Advanced Life Support, the 2010 edition. And so what I've drawn here is a representation of the cardiopulmonary system. So here's the patient's head, and then their airway starts with their mouth and nose and includes the trachea and the bronchi and culminates in the lungs, and then that feeds the heart, which then pumps blood through the circulation, and you can see that oxygen is contained in the blood. That oxygen is delivered to the tissues, and here I have a picture of the liver representing the end organ that eventually is the ultimate consumer of that oxygen. So in essence, what we have here is the airway, breathing, and circulation. And so the purpose of the airway is to get oxygen from the outside to the lungs. And breathing is to get oxygen from the lungs into the blood. And finally, circulation is to get that oxygen from the blood to the end organs. So the path of oxygen is from the outside world to the lungs, to the blood, to the end organ. Now, if something should go wrong with this system and the end organs are deprived of oxygen, this is when shock is going to develop. Now, in kids, the part of this system that's going to break down most often is one of these two, airway or breathing, since most of them are asphyxial arrests. And then this leads to cardiac arrest. So a lot of times, if you can fix problems with A and B, you could prevent the problems with C. Now, as an aside, in adults, it doesn't usually work like this. Usually it's cardiac arrest that starts the whole process. But here in kids, it's A and B that's usually the problem, airway and breathing. So watch out for signs of impending respiratory failure. And that could be an abnormal respiratory rate, so it could be either high or low, increased respiratory effort, or cyanosis. Now, shock, we said before, was due to inadequate blood flow to the tissues and inadequate delivery of oxygen to the tissues. And shock is going to show up as either one of two things. It's going to be either compensated or uncompensated. So the tissues, when they're not getting enough oxygen, the body can compensate in a couple of ways. Namely, by increasing the heart rate or increasing the systemic vascular resistance, the result of which is going to increase the cardiac output. So the result of this, what you would see you would see a tachycardia, and then you'd feel decreased peripheral pulses. Capillary refill might be decreased as the peripheral resistance goes up, and there may be cool, pale extremities. Now, as these compensatory mechanisms fail, then you get uncompensated shock. And so now you're going to see the effects of the end organs not getting enough oxygen. So if the brain doesn't get enough oxygen, then you're going to see altered mental status. And when the kidneys don't get enough blood, you'll see decreased urine output. And without oxygen, we're going to move away from aerobic metabolism and going to anaerobic metabolism. You're going to be building up lactate, and you'll see a metabolic acidosis. Central pulses will be weak, and the patient might become tachypnic. That's their respiratory rate will go up. Their heart rate may go up or down as well. And one of the last things to go is the blood pressure. Now, it's very rare that I see that blood pressures are taken in kids, so we often don't even have a kind of an intuition as to what's a normal blood pressure in these kids. But let me give you an easy way to remember the lower end of normal, so let's say the 5th percentile of normal for these kids. So when we get to these numbers, you should start worrying. So let's break the ages down into these groups. So we have our neonates here, so less than 1 month, and then our infants, which are 1 month to 12 months, so 1 year. And then here we got our kids that are going from 1 year old all the way to 10 years old, and then our kids greater than 10. So the worrisome numbers here for less than 1 month is less than 60. for less than 1 month to 12 months is less than 70. For 1 year to 10 years is less than 70 to 90. And then less than, or then for someone who's 10 years or older, is less than 90. So you can see it goes 60, 70, 70, 80, 90, and 90 for these age groups. So it's pretty easy to remember. Now, you should note this is actually a simplified version of what the guidelines actually give. They say for this one, it's really 70 plus 2 times the age. So for a 10-year-old, 2 times 10 is 90. And so for a 1-year-old, 70 plus 2 times 1 is 72. Well, close enough. I think these numbers are just a little bit easier to remember, and they're pretty darn close. And these are the age groups. You want to remember the neonate, the infant, the young kid, and then the older kid. So that's it for the first video, which is our introduction to PALS. And if you want, here's the reference. It's from Kleinman et al. From the journal Circulation in 2010. So these are the findings that led to the new PALS guidelines. Okay, we'll see you in the next video.